Hello, everyone, and welcome to this very special HL7 presentation, Career in Informatics and Standards, and a conversation with HL7 leaders. We want to thank you for spending some time with us, and we hope that with this presentation, you'll get a sense of the varied paths that each of us have taken to working in informatics and standards. And hopefully from this, you'll be able to see how you can develop a rewarding and fulfilling career in informatics. We understand that many of you are students or early career folks. We think that there are actually an opportunity for those considering a change or an expansion of your work that you're doing currently. So we have a great panel of guests to have a conversation with today. But before we start, we want to do a little level setting. For those of you unfamiliar with HL7, we are a not-for-profit founded in 1987. We are an ANSI accredited standards development organization. And what that means is that we follow a fairly well-documented and formal process for introducing, developing, testing, and publishing standards for the healthcare industry. And our goal is to develop these standards for a comprehensive framework to exchange, integrate, and share electronic health information. And if you're here listening to us, you may have heard that we have a number of standards beginning 30 years ago with our version 2 that's in wide implementation, our version 3 or CDA that is used in millions of transactions each month, and our most recent transaction, our standard of FHIR or Fast Healthcare Interoperability Resources. I used to say it was a new standard, but it's now 11 years old, so it's definitely not new. And with recent adoption by payers and providers, it's in wide use in the US as well as globally. And we are a community that it really is global. We have participation from folks in over 50 countries. We have over 500 corporate members and thousands of contributors to our work from both the standards development standpoint, as well as those who pick up our standards and put them to use to improve care and administrative processes throughout the world. And so I'm very pleased to have with us today a number of our leaders and colleagues from within HL7. First, I want to introduce James Agnew. He's the head geek and CTO of Smile Digital Health. And for those of you who have a very technical background, he'll be able to give you a perspective on his journey in working in informatics and standards. We also have my friend and colleague, Linda Michelson, who's Director of Health Interoperability Standards at Optum. And she also leads a number of our work within HL7. And so she has a great industry view and a payer view and a standards view of how they're put into work in the real world. And then I have with us Julia Skapik. She is a physician informaticist whose background she'll share with us, but can give us the clinical approach as well as a perspective on how she uses her skills both in her in the past in policy work as well as today working with providers. I'm Viet Nguyen. I am a physician informaticist trained in internal medicine and peds. And I actually stumbled into informatics. I was a chief resident in Cincinnati Children's, and they were working on implementing a physician order entry system. And I thought, wow, this is really fun. And it really fit into my background in engineering. And I asked the director, so how do I do this as a career? And the director directed me back to where I did med school in Utah, and I did an informatics fellowship. And from there, I worked in working on terminology, working with the VA, helping them develop their interoperability standards using HL7 and others, and then worked in the commercial field with Lockheed Martin and Leidos. And for the past 6 years, I've been a consultant in informatics, working with HL7 and other organizations, developing and implementing standards. And my current role is Chief Standards Implementation Officer for HL7. So this year, we're helping to expand the support that HL7 provides to the implementer community and working with them to engage in both standards work and to help find best practices and ways to expand interoperability in their organizations. So that's a little bit about me, but let's hear from our panelists. So James, can you tell us a little bit about your journey and what brought you here today working in standards?
Yeah, absolutely. I love that you described your own journey as being sort of accidentally falling into this world. I mean, I don't actually know Linda or Julia's, and I wonder if they're going to say the same thing. But I'll say our field is full of people who stumbled into the world of informatics, not even knowing it existed before they dropped into it and learned what it was. And hopefully today we can convince a few more people to have that similar journey. My own background, I'm a techie at heart. I'll say, I mean, we'll get into daily work and stuff later, but I mean, my favorite days are spent writing code, honestly. I went to college for computer science. I have always loved just sort of sitting and programming and doing those types of things. I get to do less and less of it these days, but I mean, those are absolutely my favorite days. As I said, stumbled into this completely by accident. Towards the end of undergrad, I had a capstone project, and I was sort of casting around trying to figure out what to do. And a friend of mine who was a few years older and was he was basically working for a hospital as a programmer, said, "Hey, we've got an open source library we developed. Would you have any interest in contributing to it, sort of as a project for school?" And I thought, all right, I don't have anything else lined up. Let's give that a shot. That library, incidentally, was an open source implementation of one of HL7 standards, a standard called HL7 version 2. As I sort of started learning about that, I sort of discovered there's this incredible sort of untapped resource, I think, for programmers that really, I mean, it's a fascinating domain. I say often, as I sort of reflect on career to date, healthcare, I mean, there's a lot to offer sort of working in health more generally for somebody who doesn't have a health background. I mean, there's obvious things, you're sort of having this neat impact on people's lives, on patient care and things like that, which I think for many people as programmers, you don't get that opportunity. You certainly know that the work you're doing is being used for good. You've got this great sense that, the lines of code that you're writing are helping to treat sick people, or helping people to live healthier lives and all that stuff. And that's one angle, the feel good angle. But I mean, the less feel good angle, I mean, that's the wrong way to put it. The other half to it is just that healthcare is a domain that's got so many problems left to solve. I mean, it's ultimately this information driven industry, but it's an industry that is still in many ways just so backwards. There's a joke about faxes still existing that is commonplace among clinicians, and I mean, it's not even a joke. Like our healthcare system today uses faxes like crazy, which is, I mean, in a way, it's a frustrating thing as a patient, but as a programmer, this is an opportunity. This is a problem left to be solved, and it's a thing where there's so many cool solutions out there to come by. That hook has sort of kept me here my entire career. I love this angle that it's a field that lets me do good work, that lets me use my skills for good, but it's also a field that is constantly bringing problems to me that I find so interesting to solve. So that's kind of how I got here and how I've stayed around.
That's awesome. Julia, we don't see a ton of us informaticists in healthcare and healthcare IT. Tell us a little bit about your journey and how you ended up working in standards and informatics.
Sure. Well, if I can respond to James, I'll say that I have an inbox of fax papers that are then scanned into the EHR every week. So it is not just a joke, it's reality. So I got into this work actually by doing a policy fellowship while I was still a medical student. I was actually at the IOM and not doing anything terribly technology related. But I did go do my residency because I did want to have the experience of treating patients and managing them both in outpatient and inpatient medicine. After I completed my residency in internal medicine, then I came back and actually did a policy fellowship at the National Science Foundation. And I was working actually in the Directorate for Computer and Information Science and Engineering SISE. So I was surrounded by people like James, who are technology gurus and knew very little about healthcare and were very interested to know more. And so as I was sort of learning more about federal policies in technology and health, I stumbled into the Office of the National Coordinator for Health IT, where I did a detail assisting with the execution of meaningful use stage 2, mostly initially focused on the clinical quality measure program, the electronic clinical quality measure program. And as I learned about where some of the challenges we were facing with that program lied, I learned a bunch of new techniques that are frequently used, to James' point, with great success in traditional technology industries. Things like Agile and Scrum, things like testing plans, QA tools, how to build a repository. I helped set up the VSAC with the National Library of Medicine. And then, of course, it turned out that standards are part of what underlied the specifications. And so I started participating in HL7. And, then I kept working in informatics even after I left the government, did some time with a startup that built decision support. And now I'm very happy at the National Association of Community Health Centers, a place where actually for, 50 years, the first 50 years of their existence had been mostly an analog kind of organization. And so been helping them to move into the digital space with some technology folks, with some data folks, with some clinicians. It's been very rewarding.
Great, thank you. And Linda, you've had a bunch of different roles in healthcare and administrative activities, and you lead a number of use cases that are developing standards for healthcare. Can you tell us a little bit about your background and how you have done, led up to working in standards in informatics?
Well, first I have to thank James for using our company slogan, so good on you. But seriously, you guys are talking about health informatics, clinical informatics. That didn't exist when I was in college. And when I graduated, I started out as a computer science major, and I'm really old. We did key punch back then. And I worked full time at a hospital, and I couldn't get to the computer center to do enough key punching to keep that major. So halfway through, influenced kind of by working at the hospital, I changed my major to a degree in chemistry with an emphasis in life sciences, which might be known as biology if you think about it. I started out at age 17 working in this local hospital. They had their first pathologist. He had no pathology transcriptionist available in our rural community. So he taught me, and I still can spell stratified squamous epithelium with the best of them. And so I went from working in clinical forensic pathology, witnessing many autopsies, which really helped so greatly in my work as my undergrad work. When I was getting near graduation, I wanted to go to medical school, but I didn't want to practice. And everybody was interested in having females in medicine. It was a big deal, but they wanted you to go into seeing patients. No one had a concept of how to use computers. So I worked on my master's in biostatistics. And then I was really fortunate. I've been in 3 startups in my career. One of them was a computer system for ophthalmologists, and it was everything: front office, back office, administrative, clinical, the whole thing. And I went from that role. It eventually was bought by Alcon, and I went from that role to working at a payer. And from that role to working for a little local clearinghouse in Las Vegas, Nevada, and I learned data mapping. And then I think my first real experience with X12 was when I worked for this little startup called WebMD. And I was a data mapper for them. I mapped, data from the hundreds of standards that had been used for administrative data to X12. And a company, then I started working for another startup called Clarity, which did the X12 validation. So those skills, knowing, we had to do testing, and knowing about validation and what it can do to bring a large group, the whole of the United States, onto a data standard that was mandated, and how to get them there with those testing and good air messaging in the appropriate spot to help the developer, the technician make the decisions about what to change, et cetera, really helped. We were bought by Optum, and in about 2010, I started working with clinical standards. And it's a huge data set compared to administrative. So there's definitely going to be way more challenges around it. And FHIR has made a huge difference. I've been able to work on a lot of initiatives within several accelerators. Probably the most I've worked is within Da Vinci, and looking at how to take the data that we need to exchange and make it in a computable way that you don't have humans looking at data just to check a box to say, yes, this is a diabetic met their requirement here. Instead, my hope is that we use our humans more to help our members and our patients interface with the medical community we have. It's highly complex, and that's on both the administrative and the clinical side. And those humans could much better be used in those roles than in checking boxes that this diagnosis code aligns with this procedure code or whatever other work they may be doing along those lines.
That's great. Let me stick with Linda for just a minute. Your three organizations all have individuals who have been designated and given the time to participate in standards work, and recognize that not all companies have enough staffing to do that. But can you talk a little bit about how your organizations see the value of that in terms of their own missions? Because we'd love to have more folks in, and some in the audience may be working in organizations today and could find a way to work with us. How does Optum see your engagement with HL7 and standards work?
And I will tell you, it took a while, right? They didn't even know really why we were joining HL7 when we did many years ago. And as you often quote to me, no man is a prophet in their homeland or in their own land. And it took a while for people to start even finding out. But I think all of a sudden it's like we want our value to be in the data, not in how we move it around. And why are we spending so much money on 8,000 CSV spreadsheets? Isn't there a better way to do it? So it was looking at the eyes of how we could improve the healthcare. That's what we need. It isn't about the interoperability should just be a component of it. One of the things, and to that end, it reduces costs that's spent on that overhead, right? So that's how organizations, I think, view being a part of this, and I jokingly say, call me Rose, I'm the Rosetta Stone. I may not know every technical detail, as James can attest to, of a lot of these transactions, but I know who to reach out to and what implementation guide or whatever to get people involved with so that they can figure out how to do this in a standard way. And it's a big focus for our organization to use standards. They're not naive to the fact that X12 helped them greatly with administrative data and all those uses over the years. So we want to be known in the industry as somebody who's working to make these standards work. So my role being out there and having Optum's name on it, we're really hoping will help us to attract engineers who don't just want to do coding, but they want to make improvements to healthcare. They have a mission in the work that they're doing. And I think that's really important to the young engineers that are out there today, that they can see how their work makes a difference.
Thank you. You use the term Rosetta Stone. I like that term. I've also used the term from Malcolm Gladwell's Tipping Point, that I feel like in informatics as a physician, I'm a connector. And so the question is to Julia. Sounds like what you do is a lot of connecting in your kind of daily work. How do you bring your informatics expertise and knowledge of standards and policy to supporting NAC's community in helping deliver healthcare?
Sure. So I think hopefully we're in the place in healthcare, we're starting to move to the realization that cross-training people in technology and healthcare is really a key and an almost mandatory component of being part of sort of future hybrid, virtual, digitally enabled care models. And I like to imagine that in addition to giving clinicians and care teams the time they need to do sort of the basic training for how to use an EHR or how to be conformant to HIPAA, that we also give them the time to, do work that helps add to the quality of care and the experience of care, both for the patient and for the care team. Personally having that experience, I find it very rewarding to sort of give that back to folks in the community. And I think there's a ton of untapped interest and knowledge and probably innovation that would occur if we really gave more people from the care team the space to work directly with innovators. Our team has been building a patient-facing application using FHIR to help patients understand about their HIV risk. And we needed some people to do some sort of mid-stage testing, human beings. So I just sent out an email at NAC, right, saying, hey, does anyone want to participate in testing and feedback on an app? And a huge number of people responded like right immediately. Several people actually told one of our vice presidents it was one of the most fun things they've done in their job recently. And so I think we under-recognize how much it's energizing for people to do this kind of work. I can say, I've done a lot of lean training also, both in sort of government and policy space, but also in healthcare space. And again, it really brings joy to people's work to have to have someone say, tell us what the right thing to do is, and then help us to make that part of your work. So I think, just even giving people the chance is really important. And I think thinking about different ways that we can allow people to develop those skills is really important too. Not everyone is going to be able to or be interested in doing a year or multi-year fellowship, right? Not everyone needs to have an academic degree in informatics to really contribute meaningfully. A lot of our health centers say that, some of their best people with knowledge of informatics and doing things to help them with the EHR and to manage quality and patient panels are medical assistants or people who work at the front desk. And every part of what we do needs to be optimized. So not forgetting that it's not just about the docs who already have quite a lot on their shoulders. It's about letting everyone in the care team contribute to making the system work really effectively. And those frontline people really just have so much insight into what could be better and how we can serve people's needs.
Thank you. So let's turn to James. James, you've been part of the kind of FHIR leadership and implementation community for quite a while now. And I want to note and celebrate that work that you did in the open source tools. You were able to build a company around that. So can you tell us a little bit about the kind of things that you do to work with your customers and to engage them in using standards and the products that you offer to them?
Yeah, absolutely. I mean, I guess I'll say this, my day-to-day these days has a couple of aims. I certainly spend a ton of time. I mean, the day job for sure is the promotion of healthcare standards and technologies to enable those standards for our customers. I work for a company that provides sort of an interoperability and data platform. We're used by provider organizations, by payer organizations, by research organizations to sort of unlock value from data and sort of undo barriers to getting data to the places it needs to be in order to enable care. Certainly, I spend a ton of my day sort of listening to what people could, what problems people have, how they're trying to solve them. Ultimately, how better data and better access to data, better, more nuanced availability of data, how that will make things better for them. And standards is naturally a huge part of making that happen. Certainly other parts of my job that I enjoy. As I said, I'm a coder. It doesn't matter what job I'm ever doing. I'm going to be spending a minimum 20% of my day writing lines of code, and I've maintained that my entire career. Certainly, I'll say to anyone who is considering a career, getting in as a techie into this field, make that, if it's a thing you enjoy doing, make that a goal, and you will never stop doing it. It's absolutely possible to maintain that, and I've got lots of colleagues who do that. The other big half of that is sort of, or the other big part of it is kind of advocacy for the basically the world of open standards. I think to somebody who is new to this world, I mean, just what is HL7? I mean, HL7, I think none of us here in the room today probably fully understand what it is. These organizations are big amorphous blobs that do all kinds of crazy things that none of us really get. But I mean, an analogy that I think, at least to me as a programmer, really sort of resonates is, I think about really what is open source in the first place. I mean, open source software is a concept that certainly doesn't come from healthcare. It really transcends any industry. And it's this concept that's been around for a long time of people sort of collaboratively working on solutions that collectively scratch itches they have, and ultimately, allows me to contribute a bit of code, you to contribute a bit of code, you to contribute a little bit of code. Collectively, we've written software that solves a problem. And I mean, that problem could be anything, top to bottom. If it exists in computers, there's probably open source projects that implement it. And it's this collaborative nature of that sort of makes the world of open source function. So what is HL7 and where does that go? I mean, ultimately, HL7 and the standards that it develops are the information equivalent to open source. I mean, what's being developed here are open data models, open processes for modeling data, for moving data around, for capturing data, for capturing workflows that support that, for generating documentation about how you could use that data better, for how you could move it around. Ultimately, I mean, what are we doing when we talk about these health data standards? We're talking about sort of the principles of open source applied to the information that underpins clinical care, that underpins the healthcare that we all receive and some of us deliver as well. I mean, it's fascinating to me. I love it just because, effectively this allows you to take that mindset that I think many programmers love and sort of extend it so much farther. You're collaborating, day to day, not just with other programmers. I mean, certainly with lots of other programmers, and I love that, but with clinicians, with brilliant clinicians, certainly including our friends on the call today. I mean, it's just this amazing opportunity to collaborate with just this wide variety of disciplines and sort of work together to ride towards this better, this goal ultimately of better global health.
So same with you, James. If you were kind of advising an early career, or even folks who are in their careers who want to enter into the technology space in healthcare, how is FIRE going to help them do that and really drive this kind of innovation we hope to have happen? What kind of thing? Describe FIRE for a little bit in that work you do.
Yeah, absolutely. Well, so FIRE, I'll get into it, but I'll say FIRE is a game changer for somebody who's trying to get into the industry. I mean, it's a game changer for all kinds of reasons. Honestly, the hardest thing about getting into any domain, and healthcare is no different, is the jargon and the built-in sort of the institutional memory that any industry will have, and healthcare certainly is no different. To somebody who doesn't have a medical background, you get into this, and there are so many terms and so many workflows and so much understanding that is, I mean, seemingly impenetrable. It's a really, really difficult thing to sort of, poke your nose into if you don't have someone who can explain it to you. So what is FIRE ultimately?
Now you know how I feel about computer terms, James.
Yeah, well, we're all I'm sure we could all bamboozle each other a little bit with the
our acronyms, our favorite acronyms.
Exactly. FIRE ultimately, FIRE is a couple of things. I always like to describe it as sort of three key things. FIRE sets out to create basically a set of models that model all of the things that you would need to model in order to build healthcare systems. So we're talking about basically data models for the really obvious things. I mean, how do we model, a patient and their demographics? How do we model a lab test and the results that it produces? How do we model like a letter that a doctor would write to another doctor? So there's all the really basic stuff, but it really, it sprawls out into 1,000 things from there. There's models for how do we model, research findings, or how do we schedule equipment that's going to get used in a surgery, for example, or, how do we model genomic sequences? It goes on and on. FHIR has really tried hard to create comprehensive models, but also accessible models that somebody who doesn't have, 12 years of medical training can sort of dive into and start working against quickly. That alone, I think, is just such a powerful tool to programmers. I mean, obviously these days we're in an era where anyone who can write a line of code has an idea for an app or a startup or something like that. And having this basic model that's available for free for you to incorporate into your technology, I mean, it's a brilliant thing. FHIR beyond that has started to, it's developed this amazing, what's called a data exchange framework, a REST framework. And the framework ultimately allows you to take those models and communicate them from system to system. So for example, if I'm writing an app, if I've got a great idea for an app that's going to, help somebody manage a specific disease, for example, and that app needs to talk to an EHR, an electronic health record system, to access its information. FHIR provides this amazing mechanism where my app can connect into Dr. So-and-so's EHR and pull down the information it needs. It can do that understanding the data. It can make the right requests. There's frameworks for security so that we can understand who's asking for the data. FHIR sort of gets into all of that. The third, and really, I mean, you can't forget the third thing that FHIR is. FHIR is a community, and it's an incredible community. I guess part of this question is, how would somebody get involved in the first place? And I mean, there's all kinds of ways you could do that. Certainly looking at the open source is one. There's lots of great communities for every programming language you could imagine that are very active. But I mean, even beyond just the techies, a really obvious way to find out about HL7 and its community centered around a website called chat.phir.org. That community, people often refer to it as Zulip. That's the name of the platform that underpins it. You could sort of, if you've ever used Slack, for example, chat.phir.org is kind of like the standards version of Slack. It's this big, free, open community. Anyone can participate. Anyone can ask questions. Anyone can answer questions. I mean, the hardest part about it is there's so many. They call them streams. They're like the equivalent of channels in Slack. There's so many of them. It's sometimes hard to know where to start. But I mean, the brilliant thing is this community that FHIR has sprung up. It's just so many helpful, brilliant, amazing people that it doesn't matter what your question is, whether it's the most low-level, seemingly stupid question, there are no stupid questions, but no, how basic your question is, it doesn't matter. Somebody is going to take the time to walk you through it. On the other hand,
and in
the
a
harder the
kind
question you have-
manner, and in a kind manner, they're helpful, they're not critical. And as someone who has asked some of those, as you say, seemingly stupid questions, it's good to know that community is out there.
Yeah, no question. I mean, we've all asked our share of dumb questions. Believe me, I've got many of them. I mean, this is kind of the point. Like I'd say, if you do nothing else with any of this information, spend some time looking at chat.phir.org to feel that community out. It's incredible, the thing that's built. So maybe I'll end it there.
Yeah, I agree with you. There's a lot of energy there. So let's jump over to Linda. Can you describe how your standards work in DaVinci and other places, where your experience in the real world has helped you to help lead in some of this FHIR implementation guide development? Tell us a little bit about what that process is and how useful it is to have a diverse community participating in it.
Absolutely. I am not a clinician. Every once in a while, I jokingly say I like to play on a computer, but and a lot of the topics I work with, equality, Julia is certainly more expert at quality and which ones are out there than I am. I think I always say that my epitaph's going to be, she asked good questions. And in my future life, I want it to be, she had good answers. But it's understanding enough about the clinical world both on the administrative and the, the treatment and all that, that you have enough of a background that you can ask a grounding question. But you have to have those subject matter experts that understand whatever you're working on in great detail. And you need, again, to my Rosetta Stone thing, I think I kind of play that role between those deep clinical and the deep tech. And because my background, I can ask really good questions. I think the reason I ask really good questions is I take it back to a logic class, or maybe two, that I had in college. It sounds so simplistic, but logic really helps you think in a formed way. I went to an engineering university. Everything was about reasoning, testing and seeing what happened, testing again with a change, seeing what happened. And that all of those logic principles help you to strategize your questions and think about all the possibilities, not just the most obvious path. And people in my experience, when I work with, they either go down the super happy path, like everything just works, you get this data, or the extreme, as Fire would call it, that 20%, that, if it's a Wednesday and it's raining and it's 2 p.m. in the afternoon, the doctor has a flat tire kind of questions, right? And those are great questions, but you have to build a community and get to interoperability. You have to focus on that, not just happy path, but what is most likely to happen in that 80%, and get to those and help everybody in the community feel like they're growing, both on the tech side and the the SME side. We hear a lot of intimidation from people who are subject matter experts, like, I don't know anything about computers, I log in the morning and it, kind of thing. Those are the best people to have in my mind, because they're not going to bias you about how they know a computer works. They're going to tell you, in order to do my job, I need a screen that lets me select this group or whatever, right? They're invaluable, those people with that knowledge. And if you can translate that to the tech people who will know way more deeply, whether that should be 1 table, 8 tables, what terminology is valid to use or bind. Some of that comes from SMEs too, by the way. It's a little give and take on that. And you have taught me, when you start working in this community, you have to discuss and lay out your terminology and your acronyms, because people will spend a lot of time arguing or disagreeing or trying to come to an understanding about something that is really just a matter of words.
Yes, it's actually one of the things I think is one of the most important kind of skills that we apply to our work, is keeping an open mind to what we're hearing and using our experience to analyze it. But I tell myself and I tell others, is if I feel a tinge of wanting to react, pause and ask, like, can you explain your context more, and really look to understand. I think that really helps us to make better standards. A question for you, Julia. We talked about there aren't a lot of us in informatics, and you and I are both board certified in clinical informatics, and there's a fellowship for that. And recently, AMIA has a professional path for a kind of a certification in informatics. But one of the areas that you've worked on that is going to be a big theme for us in HL7 next year is to bring together the policy community with the standards community, because I think many of us who have organizations who implement standards feel like we're having to comply, as opposed to looking at the value of that compliance. Can you tell me a little bit about how that process works for those who may be working in the policy field and not kind of a tech field, and how we need folks who understand healthcare and informatics in developing policy?
Yeah, so I often talk at least some about policy in almost every talk that I do, because a lot of both intended and unintended consequences in our industry have come about because of policy and regulatory frameworks. And I could say, with full disclosure, that not all of those effects have been, necessarily positive for the industry. So understanding what the effect of a policy or proposed policy would be is really important. And having, worked in the policy space in the federal government, I can say that unfortunately, there's just not enough experience in the industry in our employees in this space, and that is true also at the state level. I'm sure, as everyone knows, in the US, sometimes Congress will also make policies, and you can imagine they're very unlikely to have a lot of direct experience in the industry themselves. I do think a really important role of understanding policy, if you're not in the policy space, is being able to provide that experience and knowledge to the people who are trying to write good policy. As I've never met anyone who's trying to write policy who's not trying to do a good job, but usually there's just a really significant knowledge gap there. I think it's really positive that some of the changes that have been made in the last 10 years or so are really thinking more, how do we be agile? How do we account for things like versioning? How do we account for value set updates? How do we account for emerging evidence and science? What are the tools and infrastructure components that are needed to keep, two systems that want to talk to each other from finding that a lawyer is the person standing in between, for example, right? So, there are a lot of different layers to policy, and I think it's very challenging to be an expert in all of them, but certainly learning what you can, especially about components that are highly relevant to your work, is really important. And, because of the high stakes of healthcare, it is possible to get in big trouble by not knowing, what those policies are and how they affect your work. And, we don't want harm to come to patients in any way as a result of, the things we're doing to try and make things better.
Okay, great. So let's finish off with a question to each of you, and we'll stick with Julia since you're already on. What kind of things would you recommend the audience to do to engage in standards or learn more about informatics? What kind of skills do you think are really key to your success and others you've seen, and where can they learn more?
Sure. So I think it's pretty easy to learn more about standards and get involved. There are a number of tutorials if you want to do some more didactic kind of learning. But also you can just show up to meetings, sort of find a work group that aligns with your interests and sort of start listening in. I can say it's, as a person who is not a coder and it doesn't come from a technical background, it is pretty intimidating sometimes to be in a super technical group. I think that's one of the advantages of also looking at some of the accelerators, looking at some of the more implementer patient care focused work groups, because you may find that that's an easier way to kind of ease your way in. I think if you're a very technical person, though, like going for one of those technical work groups makes sense. So my points earlier about how important and valuable I think cross training is, to some extent, you may be able to find that you can sort of embed yourself or find some experiential learning opportunities just by asking, if you can work with someone who has a background different than yours, for volunteering in a project, for example, that's, developing a piece of software or trying to understand a workflow. I think if you come from the technical side, talking to people who map out workflow and explain to you the content is really, really useful. I find my team, even folks who have worked in healthcare, still sometimes need a little extra help in understanding the nuances of, say, a quality measure. Like, do we include this kind of encounter? Why would we exclude this kind of patient? Why is this data missing so often? Those questions, when you ask the person who knows the answer, teach you a very great deal about challenges that actually face all kinds of domains. So a lot of that knowledge can be reapplied to a new situation, and you can actually sort of future-proof your future work by understanding, oh, well, we have to look at what data we have that's missing, because we won't be able to execute a rule if it needs to run off a piece of information that's not there. And so you can work directly with the clinical teams then to sort of say, how do we incentivize people to enter this information? Is it not important? If it's not important, why are we asking for it? Those kinds of questions.
Great, thank you. And for those not familiar, Julia mentioned the term accelerators, and she's been involved in a number of them, and Linda is one of our leaders in the Da Vinci Accelerator. And what that is a program that is part of HL7 that I help to support the organizations who want to come together to identify opportunities for improving data exchange and interoperability, and then through a process of developing implementation guides. We bring a community together, develop guides, test them out. We have implementers, and then we get them rolled out so that they can benefit the community. And so, Linda, what do you recommend in terms of individuals getting engaged in accelerators or other activities that might lead to a career in informatics and standards?
Well, and you can do a search on the HL7 side to see the different accelerators. They all have different focuses. For example, Helios is public health. So if your interest is in public health, you can go out there and look, see what initiatives they're involved in, and just show up at their meetings and listen. And don't be surprised if the first call you're on, you're going, oh my gosh, what's up, QRD or whatever, right? And I do two things. I write it down. So, you know, you don't want to ask a million questions, but you know what? I oftentimes find I'm the one that's saying, by the way, what is the XYZ? And there are people that will tell me later, you know, I've never known what that meant. But you know, they were afraid to ask, and people are always willing to give you the answer, and they don't, you know, they will never make you feel intimidated for asking the question. It's all of these groups are volunteer, and they really want to grow that volunteer community. They want people to become knowledgeable and help. And I know if you reach out to anybody at HL7 and say, you know, like Julia, I'm really interested in quality measures. How do I fit in? Where do I go? And they'll send you to the right work group around that, or whatever area you want to focus in. And, you know, now that you know a little bit about FHIR, go out there and pull up, go to the HL7 FHIR, Google it, and find the site. And then look at some of the implementation guides that have already been created. The implementation guides are not all tech jargon. There's a lot in there about the use case and how it's intended to work. And that's one of the reasons we need those SMEs so much. We need them to help with writing that insight and that information. So it's very user-friendly, and they really kind of will work you in from the more user side, you know, the more SME side of it into the more technical. So you can learn a lot just by picking an IG that you're interested in, or a background where you've worked, or maybe your experience in college. You did, like James, a capstone about something, and you're like, oh, I can see how that would align with what I did in my college work in this area. So I think that's a really good way. And feel free to ask questions. Go to Zulip, chat.fhir.org, like James said, and just look around, see what people are talking about. There's a lot of work now. Julia mentioned governance. There's so many policies floating around about that involve interoperability. And if you're involved in that and have seen one of them, we're probably doing some work in that area to make us ready for those when they become rules are enacted.
Yeah, so I think that's great. You mentioned hl7.org/FHIR to get to the spec. Julia mentioned, and I want to highlight that we have a number of educational opportunities, both synchronous and asynchronous, for folks to learn more about FHIR. That can be found on our FHIR.org website and under training. And so let's assume we have some tech folks who go, oh, this is really interesting. I want to get in on this. James, what would you suggest are some of the basic places that a developer can, once they start to learn more, they can start to dabble and grow their skills around FHIR?
Sure, absolutely. I mean, I'll certainly start by saying I 100% echo everything that's been said so far. I could probably just say, yeah, what Linda and Julia said and leave it at that, and that would be great. Beyond that, I mean, the first thing I'll say as a programmer, there is so much free support available out there. I mean, there are free public servers you can try playing with. There are tutorials, on YouTube. There's free slides out there. There's tons of open source for really any major programming language. Dipping your toes in the water of building Fire applications, I mean, it is really, really easy to do. There is just such a wealth of great information, tooling, and support out there that you can draw on. The other thing, I mean, all of this is sort of, how to get involved in the mechanics of the standards. The other thing, just how do you get involved in the discipline? One thing I would encourage everyone to do, just because I think this is so interesting, and I try and do this as much as I can. Anytime you interact with any kind of clinician, whether that's you're hopefully not seeing doctors often, but anytime you do see a doctor yourself, if you've got friends who practice any kind of discipline or people you can talk to, ask them about their information systems. Ask them about the EHRs they use. Ask them about the information that they use to do their job day to day. And I mean, most importantly, ask them about what the challenges are. Like, these systems are far from perfect. I think we recognize that as an industry. There is always ways that these things can do better. There's always ways that, processes can be improved, more information can be enabled, and just sort of learn about what the challenges are in that. Every time I see a doctor, I will bend their ear on just what's hard for them, and eventually they kick me out of the room because they've got other people to talk to. But you'll gain fascinating insight. And I mean, the thing that you take away from these conversations is these are problems that I can help to solve. They always are. And I mean, time and time again, I've had opportunities in my own career, and you will too, to sort of think, I heard about this challenge, and here's a solution in front of me. Let's put this stuff together.
Well, thank you. I would hope the audience can sense what I feel from this panel is the enthusiasm that we have in the work that we do and how much we enjoy our work. And we hope you can find an opportunity to share in that enthusiasm and enjoyment of the work. I want to thank you all, James, Linda, Julia, for being with us today. For those who are watching our presentation, you can find more information at hl7.org. Find the developer community at chat.fire.org, and we have a wealth of information at confluence.hl7.org, where you can find more about our accelerator programs, our events. We invite you to participate in our calls. We have a working group meeting 3 times a year that has a connectathon associated with it for the developer and implementer community. And we are a big tent kind of organization, and we want to come join us and participate and help us improve the care for all individuals and populations. So thank you again to our panel, and we look forward to seeing you again soon in person at another event and more of these webinars. Have a great day.